Welcome back. Actually, it is great to hear the buzz in the room, so I thank you very much. It hopefully means that you enjoyed the session this morning and will take away some useful tidbits of information. Now we move into the next part of the session. This session will focus on the upcoming provincial election. I will be providing a bit of background about NANB's activities during previous elections and our process for identifying priorities for the organization during each election as determined by our NANB mandate. The Executive Director, Roxanne Tarjan, will review the priorities the board identified at our February board meeting. Our Manager of Communications and Government Affairs, Jennifer Whitehead, will provide an overview of our association's initiatives during the election period. And Shari Graydon will share her insights and expert advice related to political engagement, and then we'll open the microphones for more comments and questions. So we'll get underway. So as you know, the election has been set for September 22nd. As I previously noted, the Board of Directors in a session led by NANB staff identified priorities for this election for consideration of all the parties and their candidates. Over the past 2 decades, NANB has provided political priorities for action to all political parties, meeting with party leaders and candidates at their request to promote our identified priorities and advocate for their adoption as policy priorities of each party should they be elected to govern the province. NANB's board directors, chapter presidents, and staff have met with candidates from across the province in both provincial and federal elections to advance the interests of the public and the profession as it relates to health policy. A recent example of a successful initiative was the realization of the additional RN seats to respond to the RN shortage in the province over a decade ago. 75 additional seats were approved by the government elected during that period, and they were eventually funded and have increased the production of graduates over the past 7 years, stabilizing the RN supply and reducing our overtime rates in the province. So here's my message to you. This election, I'm asking for each of you as registered nurses to actively engage candidates during the upcoming election period. I recognize this is an uncomfortable activity for many of you, but I believe we provide an important service to our province and citizens, and as members of this profession, we need to make that contribution visible, and the expert knowledge RNs who work 24/7 should be recognized by the candidates in their riding. The request is simple. While the board has identified priorities we will share and would appreciate you advancing them, we believe the most impactful thing nurses can do during this election period is to make yourself visible. Imagine the impact of 9,000 nurses individually identifying themselves around the province to the candidates in your area. What an impact that will have on this election. You are an expert in your own practice. Local candidates should be interested in your experience and concerns you have about health care and nursing in your area. You are a potential voter in their riding. Identify yourself as a registered nurse when candidates knock on your door. And we were proud one of the board members shared with us at the meeting we just had that she did have someone come to her door and she introduced herself as a nurse and started chatting with them, and he didn't know the answers. And the good news was he came back with answers. So it works. It makes a difference. So identify yourself as a nurse. You are a registered nurse. Make our profession visible in the upcoming election. New Brunswick legislators approved our act in, I believe it was 1984, and part of our mandate is to advocate for healthy public policy. So using this lens, the board has identified 4 priority areas: primary health care, long-term care, drug monitoring and pharmacare, and nursing human resources. I'll ask Roxanne to expand on our priorities.
Thank you, Madam President. The fact that NANB board has once again identified primary health care as a priority should be no surprise to any of you. It has been over a 30-year journey. We are making progress. It is slow, and I know it's frustrating. However, it is the board's belief that we must maintain a focus in this area if we expect government to continue the implementation of the New Brunswick Primary Healthcare Framework and to advance the transition to community and team-based primary healthcare services. We believe that a primary healthcare approach has the best potential to improve the prevention, identification, and management of chronic and lifestyle illnesses and will contribute to the sustainability of our public, not-for-profit health system. It has the greatest potential to improve the health status and the quality of our population. We will ask the government elected to establish 10 community-based teams under the primary health care framework per year during the 4 years of their mandate. Long-term care. New Brunswick has the second oldest population in Canada. I want to thank you, Lucille. I think you highlighted all the priorities the board established in your questions the last session. 16% of our population, that's about 122,000 people of the 755,000 people in New Brunswick, are over the age of 65, compared to 14% nationally. Statistics Canada has predicted our population will continue to age faster over the next 20 years, given our economic and demographic challenges in New Brunswick. 2013 data indicates there were at that time 730 individuals awaiting assessment for placement in long-term care. Of these individuals, 491, virtually well over 500 by now, are in acute care facilities, have been medically discharged, and are awaiting placement in an alternate level of care. 22% of acute care hospital beds in our province are being occupied by patients who require another level of care. New Brunswick is the single jurisdiction in Canada where long-term care services are not part of the Department of Health. We believe long-term care must be transferred to the Department of Health to ensure the responsibility and accountability for the continuum of care. Care must be integrated under one government department and one minister. We cannot sustain the inefficiencies and complexity of this organizational model creates. And we don't want to infer by this that there's no commitment with the individuals working in that area in social development. They're highly, highly, highly engaged. We've just received in the province a Home First strategy. If implemented, it will be excellent for the province and make a difference. But the reality is we need this continuum of care integrated. We recognize their commitment and passion. However, to ensure optimal coordination and congruence, this change must be a priority for the next government. Drug monitoring and pharmacare. Pharmaceuticals are the fastest growing and expensive therapeutic intervention available to health practitioners. They have extended our lifespan and allowed those living with chronic illness to survive and lead rewarding, productive lives. It is well documented as well that the overuse, inappropriate use, and misuse of prescription drugs is a reality. The New Brunswick Coroner's inquests into deaths related to prescription drug overdoses in 2002, 2004, and 2006 all included recommendations to government to implement a prescription drug monitoring system. The New Brunswick Prescription Drug Monitoring Act received royal assent in December of 2009. Prescription drug monitoring programs support the legitimate use of medical controlled substances while limiting drug abuse and diversion. They are effective in reducing the time required for drug diversion investigations. They change prescribing behaviors, they reduce doctor shopping, and they reduce prescription drug abuse. With the implementation of the prescriptive authority for nurse practitioners for controlled drugs and substances later this year, having a functioning drug monitoring program is a priority for NANB to ensure our regulatory accountability and responsibility in this area. We must improve the prescribing practices of all prescribers in New Brunswick. The completion of this program and its implementation must be a priority for the next New Brunswick government and will contribute to the sustainability again of our publicly funded universal health system and the quality of care. Finally, in related to pharmacare, the New Brunswick government has recently introduced the New Brunswick Drug Plan. This plan will help New Brunswickers avoid catastrophic drug costs and ensure that prescription drug insurance is available to everyone. And NANB is very proud to say the paper we presented to government, really the drug plan reflected all the characteristics we wanted to see in it. However, concerns are already being raised about New Brunswick's ability to sustain this program into the future. 1 in 10 Canadians cannot afford to pay for the prescription they receive. Every developed country with a universal healthcare system provides universal coverage for prescription drugs, except Canada. Countries with universal drug coverage spend 15 to 60% less per capita for prescription drugs. The rate of growth in the cost of prescription drugs in Canada is twice that of those in European countries with a universal system. Drug costs will continue to grow in Canada given our aging population, the higher prevalence of chronic disease in this population, and the higher utilization of prescription drugs by this population, which contributes to their quality of life. Managing chronic disease and improving the quality of life for those living with chronic illnesses requires active treatment and optimal control. That's filling a prescription, usually involving an appropriate and sustained access to essential prescribed pharmaceuticals. A comprehensive and universal public pharmacare program that ensures all New Brunswick citizens, as well as Canadians, and I'll tell you why we're saying Canadians as well, have equitable access to necessary prescribed pharmaceuticals based on a national formulary, evidence-informed prescribing guidelines, and an appropriate monitoring program to ensure optimal prescribing, safety, and outcomes for all must be a priority. We believe the next New Brunswick government must work collaboratively with their provincial and territorial peers and the federal government to advance a national pharmacare program. I want to advise you as well, the NANB Board of Directors submitted a resolution to the coming CNA biennium to encourage CNA to continue their work in this area. Our resolution has been accepted for presentation and will be presented at the biennial. Finally, les ressources humaines en soins infirmiers.
Human resources, nursing human resources. Ensuring the sustainability of our health system and services through effective and affordable nursing human resources must be a priority and also must include the preparation and employment of adequate numbers of qualified RNs and NPs working to their full scope in the acute care, long-term care, and community care settings. Right-sizing the production of this workforce with employment opportunities is essential to maintaining our current educational programs. We believe RNs and NPs are essential to our health system, and evidence supports this. New Brunswick cannot afford to educate a workforce for another Canadian jurisdiction, and New Brunswick taxpayers cannot afford to subsidize the preparation of that workforce. Decisions related to the preparation and deployment of a nursing workforce must include a critical analysis of the immediate, short, mid, and long-term impacts. 2013 NANB statistics show that 25% of RNs and NPs are 55 years of age and older. And this represents over 2,000 RNs and nurse practitioners. 15%, that is over 1,000, that is 1,280 RNs and NPs, are between 50 and 54 years of age. At the present time, 40% of RNs and NPs will be eligible for retirement within this decade. The work of the newly established Nursing Collaborative must continue. And we would want to congratulate Mrs. O'Keefe Robach for having set into place this committee. And this committee must ensure the active involvement of all stakeholders, educators, employers, funders, government, and regulatory bodies to ensure the safety and quality of nursing and health services now and into the future.
Thank you, Roxanne. Now we'll have Jennifer from Communications. Thank you, Jennifer.
Merci, Madame Présidente.
Thank you, Madam Chair. You might not know this, but NANB is preparing kits on election priorities and advocacy packages for decades, and this long before I joined the NANB as part of our mandate to advocate for public health policies. Although the strategy has varied, the intent has always been to protect the public and support nurses, all in the public's interest. A few of today's priorities may also come as no surprise. The NANB has been advocating for advancing primary health care and adequate nursing human resources for many years. But as you know, change takes leadership, perseverance, and communication. Strong RN voices.
This year's election is similar to the election we had in 2010. We're implementing a few extra steps, best practices, as that was my first time through an election with NANB. What we've done is prepared, as you see, the 4 priorities document and shared it with the board, and we're looking for your feedback today to finalize that package. The priorities document will be finished, completed, and prepared for distribution come August. And what we intend to do is share with members through our electronic bulletin and on our website with multiple other resources that will be available to you for future reference. In August, we'll also distribute this package to the 5 party leaders, requesting a meeting individually with each leader. And at that meeting, typically it's Darline as president and Brenda Kenny as president-elect, Roxanne, and myself. And sometimes, depending on the availability, we may bring in a board member if it's regionally accepted. What we do or found effective last time around is we sent an email to all candidates with the package attached, asking them to contact us for a meeting. And basically we toured the province, received a significant number of meeting requests, and at that time we actually requested the local board representative, as it has much more impact. It's sort of more of a strategic move because the local politician, as Shari mentioned earlier, sometimes knows or can make that relation with the local representative. So it'll be a lot of coordination on our part in the months later in August and September, but we do hope and anticipate with this election that it'll be highly contested, and it seems to be close. So we expect to probably have high numbers of requests for meetings. In addition to that, the info nursing that'll be distributed in September, we're aiming to get it out very early in the month. Sometimes your infos come mid-month. We're going to try to get it out at the very beginning so that anyone who may not be here today or may not realize that this strategy and additional resources are available to you will be reiterated in info nursing in the fall. Additionally, we will put together a toolkit, and some of these tools will be available on our website. One of the more important ones for this particular election is to recognize that the boundaries have changed, and you may no longer live in your riding. We're going from 55 ridings down to 49. So I will have not only the NANB priorities document available to you in both languages, of course, but we'll also have a link to Elections NB, the new electoral district map, so it can help you find exactly what riding you fall into this time around, and then a link to each of the party websites, if all 5 have them, but also their platforms, with, so that you can actually get a good feel for what they're proposing in the health field and others to your interest. So that will be available to you. I think that's everything else, and we hope that maybe you'll make some more suggestions here today so we can add some extra additional resources. So we can pass it over to Shari.
You are extraordinarily lucky to have an organization that is doing all this homework, all this research, marshaling the data, developing position statements on your behalf, consulting, getting your input. The next step, the piece of actually speaking to politicians and raising your voices, is actually the easy part because they've already done all the homework and made it easy for you to do that. So I mentioned earlier that I had spoken to Globe and Mail health reporter André Picard a little over a year ago in preparation for doing something with the CNA. And I asked him about what messages are nurses not effectively delivering about themselves, about their role, about the value that would be most beneficial if they did. And this is what he said. These are his words, just to be clear. He said, "Nurses are ineffective, invisible, and too nice." They go together. He said, "We only hear from them at contract time. They're not invited to the policy table because they don't have clear policy positions. They're not pushy enough. They're too nice." Is that fair? No, clearly not. Clearly you do, in fact, have very clear policy positions, as does the CNA. But if nobody is hearing you articulate the policy positions, you might as well not have them. Do I need to say that again? If you're not stepping up at the microphones, if you're not buttonholing people at meetings, if you're not articulating the policy positions, you might as well not have them. And all this work will have been for naught, although clearly not, because they're actually not counting only on you. They're going around the province, they're doing all sorts of proactive stuff, which makes every intervention you make exponentially more effective. You know, if you see an advertisement for something once, you don't remember it. It actually takes 7 times to be repeated before you remember the brand name. Same goes when you're lobbying politicians or the public and you want to put your issues on the agenda. You need to keep repeating the messages. The more of you who are doing that, the better. In contrast, André Picard told me that doctors have clear policy positions. Oh, thank you. Doctors have clear policy positions and they throw their weight around in a way that gets results. Now, I suspect they may be even better at the throwing their weight around part than they are even at the clear policy positions. But Monsieur Picard pointed out that the numbers are in your favor, as was already mentioned. You outnumber doctors in this country by 2 to 1. He thought it was 4 to 1. It's actually only 2 to 1, but still, that's a lot of nurses. Having said that, doctors undoubtedly make more money than nurses. They are men predominantly, and they have been exercising their power and their weight for centuries. So it's understandable that they feel empowered to speak and throw that weight around. But the point is, there are a lot more of you, and if you started to speak up more often, that would make a difference. Out of curiosity, last year, I just Googled nurses and doctors in Canada because I was wondering whether or not that was reflected in the media, and this is what I found. So in fact, there were many, many, many more references to doctors, the CMA, than there were to nurses or the CNA, despite the fact that there are many more of you. The data suggests that you receive much less attention, and it's true that the news is fundamentally about power, who has it, who's making decisions in order to exercise it, who threatens it, and doctors have had more power. However, social media, your engagement with news media can make a huge impact on that. And so, you know, you have the capacity to intervene in that as well. And here was André Picard's last piece of advice. He said, nurses should be kicking ass. I don't know if the French translation quite does that. His specific advice was that you needed to sharpen your pencils and maybe your elbows to write policy demands, which in fact has been done, and sharpen your elbows to get those policies implemented. So here's my advice. Based on all of that, you need to engage more often. You know the old saying about vote early, vote often? This is engage early, engage often. The day the writ is dropped for the election, if you were to all commit on that day to emailing one politician, one political party, if you started off on day one and you set yourself a task of intervening at least once on every single day, what a phenomenal impact that would have. Yeah. The corridors of power are called corridors of power for a reason. And so you've got this great organization that is lobbying politicians, meeting with them on your behalf. And so anything you do above and beyond that, exponentially, it's like the reinforced advertisements. And you need to trade nice for forceful. And again, I know you can do that. I have watched my mother my entire life. Just as an example of how not to be powerful and advocate, a year or so ago, the CNA, probably in consultation with nurses across the country, created a really compelling action plan document. And they, associated with that, came up with all sorts of fact sheets related to their action plan. But the fact sheets, they labeled why we are worried. That was at the top of each fact sheet. Why we are worried. Nurses have a right to be worried, but the message that is relayed by language like that is, we're worried, we're fretting, we hope somebody takes care of this, but it's not going to be us because we're too busy worrying. What if the words were changed to why we need to act now? So that's just one little concrete example to make sure, thank you. Just give this to you, to make sure that the language that you use when you're standing up at the microphone, when you're talking to politicians, when you're emailing newspapers is really strong, assertive language. Don't be nice, be forceful. And tell stories. Stories are the way we move people to action. So when Diane Murray stood up and talked about Ethel, in addition to telling us an inspirational story, she manifested the very energy that she was expressing admiration for by standing up and sharing it with us. And that story that Diane told, and a few of the stories that I told, I hope you appreciate the impact that the stories you have to tell from your daily interaction with patients or the healthcare system. I'm sure you tell each other stories or your family members stories all the time. Little 1 or 2 or 3 minute snippets that really convey the seriousness of the challenges you face and the opportunities that would come about if you were to solve them. Use those stories. Meet people on a head and a heart level. You've got all this data that the NANB has produced for you. Marry the data with your stories and you'll make a huge difference. So I'm encouraging you to I gotta keep this in my hand. I can't do 2 things at once apparently. To put nursing issues on the public agenda. The election gives you the perfect opportunity for that. You've got all this great support. And you can change what gets talked about. You can be guaranteed that there are other organizations, other groups with agendas and priorities who will be doing exactly what you're being asked to do. They will be out there, they will be at all candidates meeting, they will be petitioning people at their door. And if you're not making the case for nurses in healthcare, somebody else's agenda will take over. You can be guaranteed of that. So, political canvassers at the door. Your job when somebody knocks at your door is not to politely listen to their pitch. You can do that, but that's not your only job. Your real job is to put on the metaphorical nurse's hat and say, oh, I'm so glad you've stopped by. Let me tell you what is most concerning to me and the people I interact with every day, and that includes thousands of nurses and hundreds of thousands of patients, or whatever the data is. How many of you attend all candidates meetings? because you have nothing else to do. I know, it takes time. If you have the opportunity during this election and can attend even one all-candidates meeting and muster your courage and rush the mic at the beginning, because if you hold back, and women do this, we hold back, we're waiting, we're formulating the question, we're waiting till it's perfect, we want to make sure it's not stupid, and then by the time we get up to the mic sometimes, the Q&A period is over, because 5 other people at the mic have actually spent 10 minutes each talking about their issue, and so now there's no time for yours. So here's a tip. Go to the all-candidates meeting having already articulated your question. Write it down on a cue card so that you're ready when the Q&A starts. And then use media to amplify your voices. Last week in Ottawa, a dear friend of mine, Renata, had been in the hospital for 3 days with an obstructed bowel. And during the time that she was in the hospital, the Globe and Mail printed a very large feature about, or a story, about the dangers of shorter medical shifts. So, you know, you always hear about doctors being on shift or residents being on shift for long hours. So what they found, some research found that when you shorten the doctor's shifts, the residents' shifts, there were more errors in handing over. And Renata, my friend in the hospital, watching the nurses that she dealt with over 3 days do a stellar job of communicating and relaying information from one shift to the next. She wrote a letter that got published in the Globe and Mail. She's not even a nurse. She got it published in the Globe and Mail. Nurses nailed it. You should be writing those letters all the time about how nurses are the backbone of the healthcare system, and they are the solution to many of the problems if only they would be listened to. The letters to the editor pages of newspapers are surprisingly well read. And if there are enough letters on a particular topic that get to a newspaper, that tells the newspaper, oh, maybe we should do a feature on this issue. So you could mobilize, you know, 10 nurses in your office, all write into the local newspaper on the same issue, and while you're at it, you could email the journalist at the newspaper who's most sympathetic to health issues, and the chances are there might end up being a story that you would get to comment on and be quoted in. If you listen to radio and there are call-in shows during the course of the election about the election, I'm sure there will be, pick up the phone, dial in. You can be anonymous on the phone. That's even better. You're not standing at the microphone. You got your cheat sheet right in front of you. You can ask a question, tell a story, share a concern. And then finally, you can use social media. Facebook, Twitter, LinkedIn, whatever it is that you engage in yourself, social media is a huge amplifier of what's already out there. So if there's a really valuable piece of news, either online or in a newspaper or anywhere that you think actually reflects the kind of concerns that you think are important or draws attention to the things that were identified here as priorities, tweet that, share it on social media. Mobilize people to be thinking about these issues and to be focusing on the candidates and the parties that are best equipped to implement them. I'm just going to remind you of this Alice Walker quote one more time in case it didn't impress upon you enough the first time. Does anybody remember the quote? The most common way people give up power is by believing they don't have any. You have power. Look how many of you there are. If you speak in one voice using the data that's been assembled and the stories that you live every day, you can exercise that power and make a difference. The answer to that question is yes.
Thank you very much, Shari. Now we'll open for questions or discussion in respect to anything you heard today.
Okay, look at those women
Microphone 3. And just a reminder to introduce yourselves, although Martha, I think most of us know you, but introduce yourself.
I'm Martha Vickers. I'm a nurse practitioner in Bathurst, and I've been a nurse practitioner now for 11 years. And I think a lot of what you've had to say resonates with me. As a new profession within the nursing profession in the province, I've certainly seen the good work that can come of nurses speaking up. Because who else really is in the best position but us, who are on the front lines, to be able to help educate politicians. As past president of NANB, I had the opportunity in one of the past elections to meet some of the candidates, and they're real people. They're your neighbors, they're people like you and I, and many of them haven't worked in healthcare, but many have always had had experiences with family members in the healthcare system. But the thing is, in order to educate them, I really feel we have a responsibility and a role, because otherwise they're not going to know. They're not going to understand the issues that are out there. So I like your idea of telling stories. That really seems to link with people. And the thing is, it's clarifying misconceptions right at the time that they occur, and I do that almost every day, still 11 years later, as a nurse practitioner, when I have people questioning whether they should be seeing a physician or a nurse practitioner. I work with a fabulous group in Bathurst. There's 18 family physicians. I'm the only nurse practitioner, and it can work. I was told it would never work in a fee-for-service setting, and it does work. The thing is, you have to make it work. You earn that respect and trust of your physician colleagues, and I have great admiration for them. They do look at problems differently than nurses, but that's what makes it unique when you get into that patient scenario. So it's not an us and them, it's a we. And we have to work together as a team. And moving towards health team approach, primary health care, I mean, that's the way to go. That's what I see. So I think clarifying misconceptions with the patient, with your family, with your neighbors, right at that time as to what role does a registered nurse play these days in the system, to be able to articulate that. And anyway, I hope everyone will take advantage of our ability to vote, but also to meet the candidates this fall. Thanks.
Can I tell a story?
Yes, Roxanne wanted to tell a story, and then we'll go to microphone 2.
Thank you, Madam President. I always have something to say, right? But I want to tell a story about Martha. So we're going to send out these priorities, but I don't want to leave the conception that the parties don't already know what our priorities are. We've actually had a number of meetings with candidates. I want to share with you that we have been invited to forums that the political parties have had to try and flesh out their policy pieces. And I happened to be at a session that Martha was at way back very late August of last year. And as you know, the dialogue in this province around catastrophic drugs has been quite intense, and the focus of the discussion of catastrophic drugs has been around the piece that most people perceive, and maybe many of us do, that catastrophic drug coverage is about that drug that costs $5,000 a month to take. And there were groups there that have that as their priority, and that has an implication for individuals as well. We realize that. Martha made one of the most profound interventions at that meeting. She said, well, I would like to say something a little different about, I should be having you say this, Martha. What about the person who is working in 2 jobs to keep a house for their family and to feed them and can't afford to buy their asthmatic drugs? Was hospitalized at their 2nd job out of town and lost that employment. That's what catastrophic drugs are about, and that's the power of a story. So thank you for reminding me of that, Martha.
Microphone number 2.
Hello, my name is Wendy Irinke. I'm a registered nurse here in Fredericton. So this is very empowering. Information is empowering, and I will take this information back to my colleagues and encourage all of us to participate in the elections in terms of advocating for nurses. should we be cautious or concerned? Because of course I represent the nursing profession, but I represent Horizon Health as well. So if I were to, speak to a candidate, that's one thing. But if I were to go public and write a letter to the editor or something, is there something I should be aware of in terms of being a nurse who is employed by the province? Do you understand what I'm asking? Or?
Well, my expertise is around the media, and yours might be around the politics of the situation. And my guess is that your letter to the editor is going to be respectful and constructive. You're not going to be condemning or, so simply identifying your name and the fact that you are a nurse. If you don't identify the actual organization that you're employed by, there is such a thing as freedom of speech in this country, and I suspect that would be perfectly fine. And it's very valuable in your signature line to say that you are a nurse.
That's exactly what I was going to say, and say that you have to remember you're not the spokesperson for your organization. You own the credential registered nurse. You can use that and speak to it, but you're not the spokesperson for your facility, and be very cautious of that. And if you need advice, there's communication experts within the two health authorities that can assist you. Thanks for bringing it up. I'm sure it'll be helpful to people.
Thank you.
And thanks for planning to write the letters.
Hi, my name is Amy McLeod, and I am a registered nurse. You, I think, have been inside my head. This is my first time stepping up to the microphone, so out of my comfort zone. But I started formulating my question during your earlier presentation, but I wanted to get it right, so I waited until this one, and my colleague took my question, so I still just wanted to say hi, and thank you.
Once you're up at the mic, so thank you so much for that. And once you're up at the mic, if somebody did already ask the question, you can simply reinforce the importance of whatever issue it was that you wanted to draw attention to people. So when you're at the all candidates session. Yes, yes.
Hi. I'll try to get my question in before I have to leave with Jax. But I'm Jillian Lawson. I'm the Region 2 Director, so that's Southwestern New Brunswick. I'm an RN. I'm also an NP student. Before I get to my point, I will just say that I have written a letter to the editor. It was last year during Nursing Week as a chapter president for the St. John area. And so I just simply identified myself as a registered nurse and wearing that hat as the president of our chapter. And of course, I think the message that I gave was just exactly what you said, the backbone of registered nurses and nurse practitioners and the impact that we can have with New Brunswick and public health policy and health and whatnot. But the question that I had, I participated in the MLA breakfast last month, and I sat at the table with with Brenda Kinney, with our St. John area MLAs, and that also included the Finance Minister, Blaine Higgs. It was, we had a really good time, and we established a rapport by just shooting the breeze, but we were also able to talk about some important issues and establishing that atmosphere. It was interesting to see that a couple of the MLAs were going to be retiring. One was married to a retired nurse. Another one, the MLA for the Charlotte County area, receives most, if not all, of his primary care from a nurse practitioner, and he spoke to the merit of that role. And we also had another MLA whose real interests are in education, and it made me think about how some of the different politicians and areas of the government sometimes can operate in silos, and we don't recognize how health really is not all about wait times and hospital stays. It's really about all of those underlying determinants, socio-economic determinants that influence health. So I just thought it was a really interesting dynamic. Another thing I wanted to point out, and I do have an end point here and a question, but we did have a very, very informative presentation yesterday at our board meeting by I believe he was the ED of the New Brunswick Health Council. So I encourage, and I utilize social media this morning hopefully appropriately in my role, but to my 600 Facebook friends. I don't know how to tweet, I'm on Twitter, but just to encourage everybody to check out their community profiles that they've just launched on their website. Very, very invaluable tools to educate all of our New Brunswick citizens in the various communities about all of those underlying determinants of health, and a very good source of data. But in all of this, my question is, how do we convince government and convince the public to encourage government to invest in initiatives related to health, namely primary health care, whose outcomes and return on investment may not be realized in a 4-year cycle? And they said that to us in an indirect or perhaps more direct way, and Blaine Higgs said, what can we do? Tell us what we can do, but in the next breath, it's difficult sometimes to stick our neck out depending on the political climate and some of the different interests in our areas. So how do we get past that 4-year cycle? Is my question. Thank you.
So that's a really perennial problem anytime you're dealing with politicians, and I think it's really useful to call them on it and say, we appreciate that you need to get reelected, and we also appreciate that your vision for the province is bigger than your own job prospects 4 years from now. And you need to explicitly remind them that their responsibility as a politician is not just to line their own pocketbooks and make sure they have a salary, and you can do that with a smile on your face and attribute the generosity of spirit and high-mindedness that, yes, they care about the future of the province. Having said that, I heard in your presentations that the universal drug program would in fact save money. And so you might start there and remind people that there are measures among them that we're proposing that will actually do a better job and save money, and everybody's happy with saving money.
Jerry Geldard, and I'm a registered nurse. I'll put on my Horizon VP hat, though, just to calm the nerves of anybody who wants to write letters to the editor or speak with respect to issues that are important to them from a nursing perspective. Horizon has a media policy that's clear, and if you want to speak, you're just not speaking on behalf of Horizon. You're speaking on behalf of yourself, and then you're free to speak. And it's really important to see nurses getting out with messages about what they believe is important in healthcare. Jennifer, when you gave your overview about the strategy, I was a bit concerned at first when I heard that a lot of these tools and products are going to be coming out in August. In my view, that was far too late. The election's already started. In an era of fixed election dates now, the election almost starts the day after the last one. So, but I had heard at the table and then in the further dialogue that there have been a number of other initiatives, so I think that's good. But if those tools can come out to members far in advance of August, that would be helpful. Even maybe just a summary sheet on what the key election priorities are for NANB, because we will all be engaging with those candidates from this point on. Many of them are now, their nominations are secure. There are a few left to be done from what I understand. But they'll be hitting every public event going from now until September, and most of those things are going to occur over the summer. The door-to-door campaigns are starting now. So we need to be prepped so that when those folks show up at your door or you run into them at community events, you know what angle you want to take. So August, I think they'll be quite secure in their platform by then. If we hope to have any chance to influence those individuals, I think we need to be doing it earlier, not later. But good work. It's nice to see. Now, can I ask a question about one of the strategies, or is that a topic for later? The long-term care strategy, the item on long-term care. I'm very concerned that we might be losing recognition of the fact that we are very short in this province of long-term care beds. There's a lot of attention to all of the other initiatives, and Home First will be a great initiative. All those things are great. They need to be there. But we are starting from a deficit position compared to any other province with respect to the number of long-term care beds per 1,000 population over the age of 75. And without that problem being corrected, we're going to find ourselves caught, and our patients are going to find themselves caught in hospital beds for a very long time. And the most vulnerable of those patients will never leave our environments because nobody wants them. And it is a tragedy for many of those patients and families where they are currently located. And with all due respect to the great care that they're getting from our staff, we can't do what they need in an acute care hospital. So I wouldn't want to lose the angle when we start promoting the need, the election strategy. We need to promote the fact that we need more long-term care beds in this province. And there will be, from what I understand, a review of the long-term care the nursing home bed numbers. That action will happen beginning in the fall of this year. We need to make sure that there's really strong attention to the fact that we need an increase.
Yes, Roxanne.
Thank you, Jerry. Just a quick response for everyone. The other thing about political influence is not to have a menu of 26 asks, but I want to reassure you that we commissioned a policy situation review around aging and long-term care, and that will be a resource document and I will make sure that I think it's already there, but not the reality of New Brunswick, and we'll find a way to include that in it, because there is a whole dimension around aging and long-term care for New Brunswick, but we want to be specific about that. Resource document will be there and we'll highlight that with them and remind people that the parties already really know the priorities. We believe we'll see some things in platforms, but the publication of it is going to happen later.
Yeah, sorry, yes, Jennifer, because we have, as Brenda had shared, we have been meeting with the MLAs, and actually the Premier had invited us to a meeting and the Minister of Health over the last few months, which is interesting that actually they're listening to nurses, but we need everyone's help. Jennifer, you just had
I just wanted to address the August. It should have been clear, actually. Once the priorities after today's feedback is received and once the document is translated, finalized, it'll be on our website, as will be the other tools. Once we get to that orange sheet in your kits, we'll talk about that in a few minutes. So everything will go up ahead of time, but August is the next scheduled e-bulletin that'll be distributed, and we actually reach about 90% now, closing in on 90% of our members. So that's when it'll be broadly distributed and promoted, as well as the September info. So yeah, it is a little bit late, but everything will be available on the website as soon as it's ready.
Microphone number 2.
Thank you very much. My name is Lucille Offrey, and I wanted to speak to 3 points, if I may. The first being that I really liked your suggestion on the fact that we should really bombard a politician from the first day the writ is drawn. And I hadn't thought about that, and I really think that's a powerful statement. The second point is around, and forgive me if I get a bit emotive over here, that nurses are ineffective, invisible, and too nice. That really struck home. Ineffective, who do you think brought on the Canada Health Act? If it wasn't for us, Canadians should say thank you every day. I'm not too nice right now. But I did want to talk about the points that you made about being effective. I think the NANB elections priority and having these 4 precise areas to focus in counteracts some of the invisibility, the too nice and the ineffective. Because Chantal Hébert, who we all know,
when Chantal Hébert,
there's such famous places, also said that one of the reasons that we weren't as effective and we were invisible and too nice was that we spoke to too many policy issues. We see the need of our patients and our communities, and we get very involved. So I think focusing, as NANB is asking us, is really a powerful tool, and I would invite all of us to really build on those 4 points when we bombard the media every day and our politicians, and that we continue, because that myth of our lack of efficiency has got to go. That is it. Thank you.
Microphone number 2.
Bonjour.
Hi, my name is France Marquis. I am the outgoing president of NANB. If you will allow me, I'll speak in French. And I'm from the nursing teaching at University of Moncton in Edmonton. I'm a fervent supporter of political action by nurses and by association and unions and all organizations that represent the nursing profession. I'm in total agreement with the priorities that have been established by NANB, but I want to address particularly the one of nursing resources. As you can imagine, since I'm in a training program, it's of particular interest. But I'll address it on the angle that touches on political action, but also what Madame Graydon said in her presentation at the beginning of the session, in the sense that what the nurses must do to put themselves forward at political, social levels, and so on. I'll talk to you about generations. Generations of nurses, as you know, it's been several years that I'm in the professional practice. I'm more at the end of my career than the beginning, and I invite all nurses who have a certain experience as mine to associate themselves with a new nurse or with student nurses to establish their political action and make their points valid. And I know we have students here. Just raise your hand or stand up even. There are some from my campus, but from other places as well, if you want to stand.
And I'd also invite nurses who have fewer than 3 years of experience, 3 or 5 years of experience. Are any of you here among the group who have 3 to 5 years experience? So as you can tell, the majority of participants at activities such as this are nurses with a year's worth of experience. And in order to provide and share this will to put the profession forward and take our place in political action, groups, we have to hold out our hand to younger generations behind us. And the next provincial elections and the next federal elections, team up with a student or a newly graduated nurse in order to discuss important issues, not only for population health, but also for the nursing profession. Thank you.
Bravo, bravo.
Bravo. I want to reinforce this point.
And I'll say, just from a communications perspective, if I hadn't hired a 25-year-old to support me at the beginning of Informed Opinions, I wouldn't be on Twitter. I would not be engaged in social media in the way that I am. And so when you are role modeling and working with and putting a hand out and collaborating and mentoring with younger, newer nurses, they will mentor and collaborate and support you in making your voice heard in forums that you may not already be engaged in. And so I think there's a real great opportunity to collaborate and increase your impact. Thank you.
Microphone number 2.
Good morning. I'm Fernande Richard, and I am the public representative on the board. Ms. Graydon, if your message or your invitation to us were truly understood, and women and nurses particularly began to speak, raise their voices, get published in newspapers, this would change a great many things. I wonder if you have any advice to provide about the way we might express this message in the way of expressing things in order to make sure that the message becomes more important than the hair and makeup of the person who's writing. At the beginning of your presentation today, you said that the male brain doesn't work the same way as the female brain. This is quite true, in fact, and very probably we don't even know enough about that topic yet. And so when we speak to a man, because often politicians are men, there are more men politicians than women politicians, are there any strategies, are there any ways of speaking which would allow us to garner their attention more closely when speaking to a man than when speaking to a woman? I was somewhat surprised a moment ago when you stated that there had to be messages that showed emotion coming through. And I wonder if there is not a limit to this idea of sharing emotions and feelings so that the message isn't heard as only all kinds, old tales or anecdotal evidence. I hope that question is clear enough for you. And so my question is, do you have any strategies, given your experience, to share with us if we all decide that come tomorrow morning, we're going to start making speeches and writing to newspapers? Let me try. I hope that I have understood your question, but I'll give my answer in English, because I imagine that your English is probably much better than my French is.
Interpreted your question. Perhaps Jen will assist me. So the brain research that I referred to that looks at the different ways men and women respond and orient themselves, among the things that are useful for women to know when speaking to and attempting to persuade male politicians or men generally, women often are very concerned about the process, how something happens. Men tend to, and these are vast generalizations that clearly don't cover everyone, but men are, certainly in the business environment, much more focused on results. Now, the process has a big impact on how you get to the results, but if you're wanting to convince a man of something, it's better to focus on the results as opposed to the process, because he's more likely to get impatient hearing the details of the process. He wants to get to the results. Women are more inclined to consult and collaborate. That's hugely valuable. But again, when you're speaking to largely male politicians, and if you can get to the assertion part faster. So just let me give you a concrete example. Often when we get up at the microphone, women, to ask a question, we give preamble. We'll say, I'm not sure this is the best question, or someone may have already mentioned this and I may have missed it. We undermine our authority by demonstrating that we are attentive to other people in the room. So don't do that. First, it takes more time. Secondly, it undermines your credibility. Just get right to the point faster. Eliminate the preamble. And then on the emotional side, men go to movies and read novels and, get teary-eyed at puppies or babies too. So my evidence-supported belief is that we should be telling stories and providing data both, because every time you're attempting to be persuasive, the story and the emotional context reinforces the data. So data alone will persuade some people, and emotional stories alone will persuade some other people. But data and emotional content is going to reach everybody. Did that answer the question? Yeah?
Merci.
Merci.
Thank you.
Microphone 3.
I just wanted to share it. It's going along with the same topic that was just mentioned, and something that was said earlier, in that we need to be able to tell our stories, and we need to be able to sell our message, but we have to get to it quickly. And so something that our colleagues in Nova Scotia have done is suggested that we all need to develop our elevator speech. And in Nova Scotia, they've talked about it in terms of explaining what nursing is. And I think maybe going forward in the election, we need to develop our elevator speeches around our key initiatives and match the facts in our stories, but have them down pat so that we can use them when we have the opportunities. If it's at the market on Saturday, wherever it is, if we combine that and use it and practice it, because it's not our comfort zone, so we have to practice and we use it.
That is a brilliant, brilliant suggestion. Concision is always appreciated. And most of us are more articulate and more compelling if we've had a chance to craft the message and say it out loud a few times. Absolutely. So thank you for that.
So Dawn didn't introduce herself, so I'll introduce her. It's Dawn Torpe, in case you didn't catch her name the first time. Thank you, Dawn. One of our finance people told me, Darline, be bright, be quick, and be gone. So maybe that, I don't know how bright I was, but I was quick. He obviously wasn't going to listen for long.
Can I make just one other suggestion on that point about having the elevator speech down? Is that if you go to any meeting where you have an opportunity to have a voice, you ideally don't want to have to read from a prepared statement, because then you can't actually see when the politician's eyes glaze over and they stop listening and they start checking their BlackBerries. So a little bit of preparation and having told the story or the anecdote or described the pitch to your husband and your kids and whoever will listen to you in the Safeway checkout line first is a good strategy.
Well, great. Seeing nobody else at the mic then. First, I would like to remind everybody you have a green sheet in your package. And so, as discussed,
You were looking
sorry,
at the green
I'm
one.
looking. My sugar must be down. I think I need lunch. It's orange. I'm not colorblind. My father was, but I'm not. So yes, the orange sheet, if you would, what that is, as Jennifer shared, the Board of Directors has set the priorities for the election, and we have started meeting with the politicians, but we want your feedback in case we're not on the right track. So we would greatly appreciate you to fill this in and leave it on the table with your comments, and we will take that and incorporate it into the package and the tools we do up to have available for nurses. And absolutely it will be, as Jennifer said, ready as soon as possible so that you will be able to engage with your politicians. So if you'd please fill that out. And I'd like to thank Shari Graydon for being here today. She has been wonderful and given lots of insights and challenges, and hopefully will help influence us as we move into this election. Watch for the announcement on the NANB website, because Shari is going to be our context expert for our next virtual discussion this fall. So we will have it on the website, Info Nurse, and the virtual flame, our e-bulletin. So please, in closing, I'd like to, hopefully you've been a little bit energized and motivated this morning. So, thank you. So just, I don't have to remind you that you're a registered nurse and how great and wonderful you are. What I do need to remind you is we don't say it often enough. How many times in your communities are you volunteers? And I know myself, I meet with community people all the time because you live in communities. You interact with other healthcare professionals, you interact with family and friends, you belong to groups in your community, whether it's the church or some of the other volunteer organizations, from your Women's Institute to different lodges, maybe you're the Rotary Club. Be proud and say you're a registered nurse. You have knowledge and it matters, and I am constantly amazed at how little the public knows about the healthcare system if they're not interacting on it on a daily basis. And you're the expert and you have that knowledge. So if you don't walk away with anything else, don't be afraid. As Shari shared, we will send you out a toolkit that you can use, have your message prepared, and even if it's nothing but saying, I'm a registered nurse to those candidates, and 9,000 registered nurses say, I'm a registered nurse in this province, and I have something to say about the healthcare services we deliver, it'll make a difference. I just wanted to comment that we do represent registered nurses and nurse practitioners, and we all work in different fields. So I wanted to make sure that because I say registered nurse, we are all registered nurses. That's what we start at. And then most of us have lots of other titles that we have, but at the end of the day, I'm a registered nurse. Be proud, you're bright, share that knowledge. And as some of you shared in the room, the politicians are blank slates. They really have little knowledge about the healthcare system that they've been educated, that they have been elected to do something about. And as a few of the board members shared with you, when we met with the politicians this last year, I was kind of discouraged that I elected people to make a decision, and they say to you, what do you think I should do? I'm sorry. Share your knowledge. They're asking for it, so give it to them. You are the experts. You work in it every day. So thank you very much. Just one last comment. For those attending the forum at your own expense, I just want to remind you that we do cover the fuel costs. So all you have to do is send us the receipt, and we will be pleased to reimburse that. And that we will shortly break for lunch, and I would encourage and hope everyone's staying for the annual meeting this afternoon. It will start at 2. It is a business session meeting, so it won't be that long, but I would greatly appreciate you staying. It gives us the opportunity to share the annual report with you and the financial statements, and that's our obligation to you, the members, who pay for the service we provide. So I'm hoping you will stay for lunch. And I thank you very much, and I hope you're motivated and enjoyed this session.